I think we're all here because we're all concerned about a very serious problem that has been plaguing Tennessee and unfortunately has not gotten a lot better. We're here today because we agree that there's a serious problem in our state with the abuse of methamphetamine. It's a difficult issue and it's an important discussion to have, and I know the legislature anticipates having discussion on this issue. Despite our efforts to date, meth production remains a serious public health and safety issue in our state. The results are tragic and deadly. We had nearly 1,700 meth lab seizures in 2013. Last year, nearly 300 children were taken into custody at the Department of Children's Services in cases where meth was a contributing factor. We're proposing a bill to limit the access to pseudoephedrine and ephedrine to those who are using it illegally, while, and this is important, not punishing the 97% of Tennesseans that are buying it and using it on a temporary basis to treat cold and sinus symptoms. We're calling this the Tennessee Anti-Meth Production, or TAMP Act. Our plan is to allow individuals to purchase up to 2.4 grams of products containing pseudoephedrine or ephedrine in a 30-day period. If you're not a buyer of those products, that's the most frequently purchased box size now, 2.4 grams. It would work the way it does now. You would show your ID to the pharmacist and buy your medicine at the pharmacy counter. If you returned to buy more in that 30-day period, a pharmacist, at his or her sole discretion, may allow you to purchase up to 4.8 grams in the same 30-day period. Anything above 4.8 grams in a 30-day period would then require a prescription issued by a licensed physician, certified physician assistant, or an authorized nurse. Since 2012, as you know, we've used electronic tracking of purchases of cold medicine ingredients used to make meth through the National Precursor Log Exchange, or NPLEX. But this has not solved our problem. Too many criminals have continued to operate too many meth labs in our state. We know that 97% of the people, and that's really important to know, who buy cold medicine containing pseudoephedrine or ephedrine buy less than 4.8 grams per month. One of the schemes used to obtain substance for meth production is the practice known as smurfing, where people who cook meth rely on a team of people to buy those substances at their current limits. This legislation will address that practice, lowering the threshold allowable in the initial purchase. We'll then allow pharmacists, qualified specialists on the front lines of this issue, to use their professional judgment in dispensing these drugs. Only in the most extreme cases do we then require approval by a physician. This will effectively give Tennessee the lowest limit on purchases of these substances in the United States.
I first want to say thank you. I want to say thank you to Governor Haslam, to the legislature, for understanding and hearing the cry of law enforcement, who for many years have been drowning under the scourge of methamphetamine that has spread throughout the state. 10 years ago, it was an East Tennessee problem, rural East Tennessee problem. Today, it's just as much of an urban West Tennessee problem, with over 80 labs being discovered in Memphis last year, as it is a rural East Tennessee problem. It's a problem that's affected so many citizens in this state, so many children in this state. And for law enforcement, we've just totally drowned under the weight of methamphetamine in this state. So we're encouraged, we're optimistic, we're excited, and we're ready to